My name is Lisa Doyle Parsons, and I live in Wood County, West Virginia. I have a pretty long and complicated healthcare story. In my younger years, I was just healthy as a horse, no problems, no issues. But then, probably about the time I hit 35, 40, I was diagnosed with multiple diseases, some more serious than others, but currently I have, of course, high blood pressure, diabetes, COPD, and I've had several heart attacks and a stroke. And I have, in January of this year, had a very severe case of COVID where I was hospitalized and was in acute respiratory failure and had sepsis and was very near death at that point. Well, currently I am taking two medications, and that is for my blood pressure and my diabetes. That came about as a result of me being hospitalized in January with COVID. Prior to that, I did not have access to the medications I needed, so I was not treating those illnesses. I previously, probably since 2016, I had medical insurance through my employer. But when I left that position in 2016, and I've not had health insurance since that time. So that has made the ability to get the medications that I need for preventive care and for maintenance pretty much impossible. I have paid like out of pocket for the doctor's care in order to get the prescriptions that I need, but often, such as right now, my last doctor's appointment, I didn't have that extra money to pay the out-of-pocket expense to see the doctor. So currently my blood pressure medication, I have none. Even the ones that I do take, and I do try to maintain those two medications, there are several other medications that I've just totally written off because I know that I absolutely cannot afford them. And that a great example of that is when I was first diagnosed with COPD, there was a medication that at the time was like the top of the line medication for my condition. And it was about $400 a month. So my doctor at that point, that's when I was still insured, he did give me samples, as many as he could. But, eventually I couldn't get the samples any longer. So I have not taken that medication since 2016. And, I think that clearly, as far as like my lung capacity, my ability to breathe, strenuous physical activity, that impacts that greatly. So it can really destroy your quality of life. I kind of compare having the medical care and the access to medication kind of like car maintenance or home maintenance. If your car, you don't put oil in it, that thing's going to break down. You're going to burn your motor up. I am 55 years old, and there are days I feel like a 90-year-old because I think the quality of life that I've had has been severely impacted by that inability to get the medications that I need to maintain my body. My body is just being torn down every single day. Every single day is like it's in a worse state of repair instead of, getting stronger and healthier. And, I'm a person that has worked my entire life from, being a teenager, taking a job still in high school, to currently I'm the director of a nonprofit agency. And even, somebody that works 40, 60 hours a week, I still don't have the access to the care and the medications that I need. So I would like to see, something done to make medication more affordable, that somebody in my position, what I would call the working poor, has the ability to take care of themselves and increase their quality of life. I would say that the access to healthcare and affordable medication not only greatly decreases one's quality of life, but also unquestionably reduces one's lifespan. I have 3 brothers that are now deceased because they did not have the ability to get the health care or medications they needed to keep them alive. I, at 55, have outlived 3 of my 5 brothers because they could not afford to have the medications they needed to keep them alive and to give them a quality of life. So the lack of access to medication, it actually not only decreases quality of life, but literally kills. So I really feel it is critical as a community, as a nation, that we do something to help make medications more affordable and accessible to those that are, struggling, wanting a quality of life, wanting to live. I have a lot to live for. I have 2 wonderful children. I have great nieces, great nephews, family, community that I belong to. I don't want to see my life snuffed out because I can't access my health care and I can't access blood pressure medication or diabetes medication. And I don't want to see that happen for others either.